Hi guys, welcome back to Toria Scrum. This is Victoria Owusu, a registered nurse. If you are new here, hi! Thank you for hanging out with me today. As you read by the title, we are going to look at a detailed explanation of the new NCLEX format. Don't forget to like, share, comment, and subscribe. So I want us to look at an example of the NCLEX question. I'll either put it here or there. So every time I put a video out there, I'll try my best to put one NCLEX sample question. So today the question for the day is, the nurse calls the health care provider regarding a new medication prescription because the dosage prescribed is higher than the recommended dosage. The nurse is unable to locate the healthcare provider and the medication is due to be administered. Which action should the nurse take? 1. Contact the nursing supervisor. 2. Administer the dose prescribed. 3. Hold the medication until the healthcare provider can be contacted. 4. Administer the recommended dose until the healthcare provider can be located. So that is the question of the day. I'll either put it here or there. So at the end of the video, I'll just put the correct answer at the end of the video. So let's get started. I want us to look at the detailed explanation of the NCLEX. So coming April 2023, they're going to introduce new formats for the NCLEX. And based on the changes they've made, they've grouped that into like 6 points. So we're going to look at all those 6 points today. And if you have any question, you can just leave it in the comment section and I will try my best to answer to the best of my knowledge. So let's get started. So the first point is case scenario questions. So they're introducing this type of question. Now they're going to give you a scenario, and based on that scenario, they're going to give you 2 to 8 questions for you to answer. The case will provide you patient record. So based on the scenario they put there, it has patient record, patient diagnosis, everything you need to know will be in the scenario. And they will ask you 2 to 8 questions for you to answer based on the scenario. That is the first one. So the second point is extended select all that apply. So previously we were doing select all that apply, but the new one is if you have the question and it tells you to select all that applies, you have to, they're going to give you 8 options, a maximum of 8 options for you to select from them. Previously it was like 5 to 6 and you select which one you think is part of the answers, but now they add in some to it. So you have 8 answers to choose from. If all is right, you choose. If 3 or 2 or 4 or whatever you think is right based on the question, then you choose. So that is the second point. The third point is drop down answers. So here, so it can either be multiple choice or it can be filled in. So these questions will provide you with a drop list that can be possible answers. So it either can be multiple choice as you click on the drop down to select, or it can be either fill in. So that is that one. So and the next one is extended drag and drop. So it's same as before, but they will have more answers than spaces. So you have your extended drag and drop, right? So you have more spaces here and less answers to drop. So it's up to you to choose wisely which one you think should be selected to the next space. Then we have highlight test. That is the next one. So for this highlight test, I think it's a new thing that they're bringing on board. You have a passage or a case study or a case scenario, and you are going to highlight which part you think is right based on the question they ask. So if you have the scenario here, they asked a question for number 1, you're going to highlight on the passage or the case study where you think is the answer. Like maybe, I don't want to give an example because I don't know how it's going to look like, but I know that you're going to highlight from the case scenario what is the answer. So the next one they also have is metrics/grade. So in this case, some of the example can be, there may be a list of 8 different interventions for which you have to choose if they are anticipated, essential, or either contraindication. So based on the intervention they give, they can either give you 8 nursing interventions. They're going to ask you, which of these do you think is complication? Which of these do you think is anticipated? Which of these do you think is essential or non-essential based on the scenario they give? So these are a detailed explanation. If you have any other question, you can leave it in the comment section and I'll be happy to assist you. But for the answers to the question I already read, so the answer was contact the nursing supervisor, which was 1. If you have any question for the answer, you can comment down below. I'll write the reason why the answer was contact the nursing supervisor in the comment section, and I'll just give a little details about it, why they chose contact the nurse supervisor. Don't forget to like, share, comment, and subscribe if you haven't already. Okay, thank you very much. See you next time. Bye.